Thank you for joining me today. In this video, we are going to continue our case studies, and this is second part of the case studies. In this video, which is the second part, I'm going to go over case study based on general anxiety disorder, OCD disorder. There's other case on OCD, and there is a case study on borderline personality disorder, and there is a case study on PTSD. So stay tuned. Thank you. So our first case study is generalized anxiety disorder. We have a 35 years old with a chronic excessive worries, muscle tension for more than 6 months, and we diagnosed with him general anxiety disorder because those are the symptoms of general anxiety disorder. Treatment options are SSRIs, SNRIs, and cognitive behavior therapy. We're going to monitor the anxiety severe scale. We're going to monitor the sleep pattern, function impairment. Education include worries is treatable condition, avoid reliance on benzodiazepine, and the behavior techniques are essential. That's what we are going to teach the patient. And then we are going to set up a follow-up appointment 2 weeks to 4 weeks after the medication initiated. Our second case study is the OCD disorder, Obsessive Compulsive Disorder. We have a 30 years old with intrusive contamination fears and repetitive hand washing for hours and days. Treatment options is a high dose SSRIs, for resistive case. If the case continues and it is recessive, we are going to have them clomipramine, and then also we are going to do exposure and response prevention therapy. We are going to expose to them the fears that they have, and then the medication clomipramine, its other name is anaphylactine, is a TCA medication. We are going to monitor them. We're going to monitor the severity of the symptoms. We're going to monitor functional impairment. We're going to track if they're getting worse, if they're getting better. We're going to educate the patient about the symptoms and the conditions, and we are going to educate them The obsession are not dangerous thoughts. Avoid compulsion gradually. Treatment requires time and persistence. And then we are going to set up 2 weeks to 4 weeks during the titration, because we have to titrate the medication. Our third case study is PTSD. We have 28 years old with flashbacks, nightmares, avoidance, hypervigilant after combat exposure. Treatment options will be trauma-focused cognitive therapy, trauma-focused cognitive behavior therapy, eye movement desensitization, and reprogression therapy. Then the other therapy is this SSRI medication. We are going to monitor the sleep quality, suicidal ideation, substance abuses. We're going to educate the patient about trauma reactions are treatable, avoidance behavior when it's safe. Therapy is the first line for PTSD. We are going to set up follow-up appointments within 2 to 4 weeks initially to know if the treatment are effective, if the symptoms are improving, if they are functioning well in the society. We want to do that. We want to set up the 2 to 4 weeks follow-up appointment. And then our final case study is borderline personality disorder case. We have a 24 years old with unstable relationship, self-harming, and fear of abandonment. Symptoms are unstable relationship, self-harming, and fear of abandonment. And the diagnosis is borderline personality disorder. What are the treatment options that we have? We have the first line will be Dialectical behavior therapy is the first line. SSRIs for mood stabilizer symptoms. So we have SSRI for mood symptoms. We have mood stabilizer and also antipsychotic for the impulsive. We want to monitor self-harm, and we want to monitor also therapy engagement, if they are engaged in the therapy and compliant with their treatment. We want to also monitor the medication side effects. We want to educate the patient about therapy is a primary treatment, because the therapy is the first line of treatment, and then emotional can be regulated with skill training. Medication is a supportive, not the cure. We will have a follow-up appointment to weekly therapy initiation and medication follow-up every 4 weeks. Thank you for joining me today. I would love to see you in my next video. Please prescribe and join me next. Thank you.